Well, let's just talk a little bit about the private healthcare sector in Nigeria and some of the opportunity there. In 2010, it seemed as though patients in the health who were insured by private healthcare insurance were estimated only at about 7 million in Nigeria, huge country. So what are the opportunities that you are seeing still in that space?
Well, what is happening is that many more people are embracing the health insurance scheme, and the private sector is really becoming better at both healthcare management and providing direct healthcare services. But a lot needs to happen. As you know, in a population of about 160 million, there is a in fact, the uptake of health insurance is still so low. So we need to make sure that we improve on the awareness and the acceptability of health insurance.
Let's just talk about how affordable it is, because one of the concerns, it seemed, was that when it came to regulation with the private healthcare system, it didn't seem as though the regulation was effective enough. And what was happening then, there was the concern that the prices in the healthcare industry space were much higher than the inflation rate. So talk to us about the cost of private healthcare in Nigeria.
Well, you have raised a very critical point in the terms of costing. But more importantly for me is the issue of the comprehensiveness of services that they provide. Take, for instance, how many of the health insurance schemes cover pregnant mothers, especially young pregnant mothers. We are also looking at issues around infertility, looking at issues around cancers, and then the issue about young people generally. Are they adequately covered in the health insurance scheme? I think we need to, beyond working on the cost, because the issue of cost may have to also do with volume. If you are not covering a wide range of the population, then your cost is likely going to be high, the demand and supply issues. So for me, we need to have a rethink or refinement of our health insurance scheme to be able to take in a greater population.
Doctor, where does this discussion happen? You say this is what needs to happen, but where does this discussion of what needs to be happening to be able to reform this particular sector, who do you talk to? Who are the people that are supposed to be talking to change this?
Okay, you know, the Federal Ministry of Health has an agency responsible for health insurance. But because health is also on the concurrent list, it has to happen at all layers. Interestingly, the federal government does not seem to have the population per se. Most of the populations are domiciled in states, and therefore state governments are primarily responsible for providing healthcare along with the local governments. So we need to have a very integrated scheme that ensures that people at community level have a sense of ownership and have a sense of trust in the scheme, and are therefore willing to be participants in the scheme, not just beneficiaries, but see themselves as co-owners of the scheme. So we need a non-conventional health insurance scheme, and this has to come from a lot of what I call bottom-up conversations. So we need to go back to the communities and let people understand the benefit of everyone contributing some amount for health, and then this can aggregately be used to improve the health, especially also in the areas of prevention, because as you know, curative is always more expensive, but preventive healthcare, which is not only the function of health to deliver, because we are looking at determinant factors of health, water and sanitation, nutrition, you know, all the infrastructural issues, and all of these are very important for health delivery.
When it comes to national health insurance, it seems as though the government did step in there in 1999 and kick-started the national health insurance for the country, but there has been criticism that hasn't rolled out well. And one of the criticisms has been, as you were saying, the layers, you know, that you've got the federal government, you've got state governments, and that somewhere in between all of those layers, what needs to really happen on the ground for Nigerians is not taking place.
You know, one of the greatest criticisms of the scheme that we know is the fact that many people who are on the scheme complain that there's provider discrimination against them. And therefore, I even believe that presently there's a challenge of disbursement and supervision of the scheme as it is, in terms of how do the providers get paid by the health maintenance organizations? Those areas seem to be a little gray, and the worst hit people are the beneficiaries. And we get this complaint continuously. I don't think that the way we are going currently is the way we should go. I believe the government should, because they are taking the lead, allow for other players, key players, to come in and help them shape the health insurance scheme.
When you talk about that, we were talking about cost. When you say of other people coming or other players coming into the market, again, let's look at that number, about 7 million in 2010 of patients that were on the healthcare scheme out of a population of more than 160 million people. 7 million is so minuscule to have more players come into the market. Just talk to us about what you envision happening for these players to come, and what their benefit would be to coming in.
First is that shows you that people don't have confidence in the scheme as it is. And therefore, we need to use what is called evidence-based perception of people to address the inequities and the ambiguities in the scheme. So government has to commission multiple researches, ethnographic, sociological, not just the very epidemiological type of research, to find out what is it that people really need to see. That is one. Two is to look at the administration of the health insurance scheme. People want to be involved in the way their health is managed. They don't want a top-down approach. And they know the issues that are most critical to them. And therefore, if you don't listen to them, there is no way they are going to subscribe to the scheme. The third, of course, is to look at the price regimen of the scheme to say, okay, if I put in X an amount of money, and I have, in fact, a practical case at hand of a family member of mine who subscribed to a very comprehensive scheme.
Doctor, I'm going to have to step in there.
Benefit from surgery.
Doctor, I'm going to have to step in there.
And it was a lot of money.
We've completely run out of time, so we're going to have to end our interview there. Thank you so much. Unfortunately, we've completely run out of time.